Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer in the United States, also an Associate Professor of Medicine today. And we are going to talk about how a common product we use, the mouthwash to clean our breath, right? How does it increase our blood pressure? Studies have shown that daily consumption of, when I say use the mouthwash at least 2 times a day for 7 days, it can increase the blood pressure. Scientifically proven, my friends, okay? We look at the mouthwash sales in the United States, close to 500 million. Everybody loves that. I know I love taking those mouthwash, but I don't do it anymore. But when I take a mouthwash and clean my mouth, I feel fresh, okay? That's what you get addicted to it. You want to use it again because of that freshness. You feel your mouth is, the odor, and there's no odor and all that. Okay, so today we're going to look at how does a mouthwash can increase your blood pressure. That's the whole purpose of the talk. Okay, now when you look at it, the mouthwash, let's look at a product we know the body produces called a nitric oxide. That's very important to maintain our blood pressure. Okay, that if you have enough nitric oxide, your blood vessel becomes dilated and your blood pressure goes down. Let's say if you don't have enough nitric oxide, your blood vessel gets constricted and your blood pressure shoots up. Okay, the same thing happens. What happens is the mouthwash, okay, that kills the bacteria in our mouth, which helps in the production of nitric oxide, and there's less nitric oxide, your blood pressure can shoot up. So today we're just going to go deep inside and find out how does this nitric oxide and how does this bacteria, how does the mouthwash adversely affect them. Okay, so when you let's look at the nitric oxide production first. We have endogenous pathway, use L-arginine and oxygen with nitric oxide synthetase produce nitric oxide. Then you have the exogenous pathway. That's what I want you to focus on. It has, when you use when you take food leafy vegetables and all that, it's converted into nitrate and then nitrite, and then it produces the nitric oxide. So the bacteria plays a very important role in this. Once the nitric oxide is again converted to nitrate and nitrite, and then it absorbed into the salivary gland. Okay, once the salivary gland, it again converts into the nitric oxide by this anaerobic bacteria. Okay, and this anaerobic bacteria help this nitric oxide get into our bloodstream. When it comes to the nitric oxide, they come to the cell, convert GTP to CGMP. It happens in the endothelial cell, okay? And then CGMP, you got protein kinase, and that is converted into, that inhibit the calcium. When the calcium enters into the cell, you can have vasoconstriction. Okay, you want less calcium. So the nitric oxide make the calcium less. And then you got your blood vessel become dilated and it lowers the blood pressure. Okay, it's an extensive pathway. Again, if you use mouthwash, it kills the bacteria and less nitric oxide production. So what happens is you can have blood vessels become constricted and your blood pressure goes up. Okay, so remember, when you use mouthwash next time, it can increase your blood pressure. It's scientifically proven. Thank you so much for watching.